So good afternoon. Today we're going to be outlining the work we've been doing across the Commonwealth to keep people in Massachusetts safe and informed as we head further into the fall and winter months. Over the past few weeks, we started to see an increase in the number of COVID cases here, across the country, and in many other countries. For months, public health experts have forecasted this increase. We are going to be living with COVID until there is a vaccine or a treatment. But the Commonwealth's response to this pandemic has been transformational since last spring in nearly every aspect of our daily lives. In March and April, the medical community was still learning nearly everything about the virus. Public health experts everywhere were scrambling to understand transmission, infection rates, and to develop a medical response for testing and treatment. At the same time, states were left to coordinate strategies, often without much assistance from the federal government. Here in Massachusetts, we had serious limits on personal protective equipment and were left to fight it out with a broken global supply chain. There was essentially zero testing infrastructure available, and it was hard to quickly diagnose this new strain of coronavirus. In the absence of a public health and medical infrastructure that was prepared to deal with all of these issues, states were forced to close non-essential businesses and schools and encourage people to stay home. I've said many times that the spring felt like one long day, and that's because we were working around the clock to respond to the changing facts on the ground. We moved quickly to set up the COVID Command Center in March to coordinate our response, and our cabinet coordinated with stakeholders, speaking regularly with groups like hospital CEOs, local officials, education and business leaders, and long-term care providers. And through all of this, the people of Massachusetts showed incredible resilience and discipline. Your actions in those early days had a huge impact on slowing the virus and keeping people safe. And as we stand here in mid-October, we've been fighting COVID now for 9 months. And together, we've made tremendous progress to build a massive infrastructure to respond to this pandemic. And this progress puts us in a strong position to be prepared for whatever comes next. We're home to some of the brightest minds in healthcare and research. We've put our best people, in many cases, in charge of creating and advancing some of the nation's leading programs and resources to fight COVID-19. And we also set rules to keep residents safe as we reopened nearly all parts of our economy. For example, Massachusetts is now number 1 or number 2 in COVID tests performed per capita in the U.S. We were the first state in the nation to build out a contact tracing program. We were one of the first states to issue a statewide order for face coverings back in May. We provide on a daily and weekly basis a robust set of data and statistics to the public to track infection rates with a breakdown by community and for settings like nursing homes, child care providers, colleges and universities, and public schools. We deploy teams to high-risk communities to promote public health awareness and to step up enforcement. We maintain strict guidance for all businesses to safely reopen and have approached this in a more cautious way than many other states. We've issued hundreds of pages of guidance endorsed by the Massachusetts chapter of the American Academy of Pediatrics to safely get kids back to school to learn in a classroom. The Commonwealth has also built an army of experts to advise and fight COVID with us. And we'll bring every resource to bear in this battle to keep our residents safe and our communities intact. But there is no doubt that this virus will continue to challenge us. We've been working to get ahead of the obstacles that have been thrown in our way since last spring, and will continue to do so going forward. And as a result, we are better positioned to respond and protect Massachusetts. Last spring, we worked closely with leaders from the Commonwealth's world-renowned healthcare system to make sure our hospitals were ready for increased cases. This planning paid off. In many places across the globe, healthcare and hospital systems were overwhelmed. Not here in Massachusetts. In April, the number of COVID patients being treated in the ICU reached a maximum of 1,085. Today, there are around 80 patients in ICUs, a 90% reduction. Last spring, we saw a peak of about 4,000 patients being treated in our hospitals for COVID. Today, we have about 500 patients in our hospitals who have either tested positive for COVID or are suspected of testing positive, but the actual COVID patient census across Massachusetts hospitals these days is less than 300. That also represents a reduction of more than 90% from last spring's peak. When we reopened hospitals and ambulatory healthcare service providers, hospital systems had to attest to meeting strict capacity guidelines to make sure they were always prepared for new cases. Today, hospital occupancy statewide stands at 68%, and ICU occupancy stands at 52%. Hospitals deployed surge plans in the spring and have spent the past months refining those. The Commonwealth is now in a position to quickly expand capacity to care for more COVID patients if hospitalizations dramatically rise. If needed, at least an additional 450 ICU beds could be made available by converting existing med-surg space. In the spring, we also created temporary spaces to accommodate patients by setting up 5 alternative medical sites with the capacity to serve over 1,000 individuals. These sites are decommissioned now, but MEMA has the equipment ready to rapidly stand up if a facility is necessary. Secretary Sutters and I continue to talk to hospital leaders several times a week to track any trends they see and to make sure they're prepared for any future influx of cases. Their cooperation and ingenuity has made a huge difference in battling this virus. Now, before COVID hit, most people probably had never heard of personal protective equipment, so-called PPE. But overnight, global supply chains were disrupted, and states were left on their own to track down these critical materials. Massachusetts pursued every piece of equipment we could find and never stopped. To date, the Commonwealth has distributed over 36 million pieces of PPE, including almost 11 million gowns, nearly 11 million gloves, nearly 800,000 gowns, and over 24 million face masks to hospitals, first responders, long-term care communities, and others. We also worked with Massachusetts companies to start producing PPE here, everything from masks to gowns, and they're still in very active production. For the most part, hospitals are reporting that supply chains are back to normal, but that hasn't slowed down our efforts. We've continued to add millions of pieces of PPE to the state stockpile over the last several months, far more than we have ever had before. And based on the PPE we now have and shipments we expect later this fall, we have sufficient PPE to support emergency supply needs of healthcare and human service providers and first responders from now until the end of 2021. We've also increased the number of ventilators in the state stockpile. Early on, we were completely reliant on the federal stockpile for supplies, and in the spring, we were able to deploy about 675 ventilators to hospitals that needed them. Today, we have more than 1,200 ventilators in our stockpile, obviously almost double. We've scaled up the Commonwealth's COVID testing program at a rapid clip since last spring. At the end of March, we were conducting about 2,000 tests a day. By May, we were conducting about 13,000 tests a day. And now we regularly conduct over 60,000 tests a day. Over 4.8 million molecular tests have been reported to DPH to date. Over 2.4 million individuals have been tested. About 1 in 3 of our residents have gotten tested at some point over the course of the past 7 months. In the coming weeks, we'll have the capacity to administer more than 100,000 tests per day. In the early days of the pandemic, we were heavily reliant on large, mostly out-of-state labs to do most of our testing. We started with less than a dozen labs that were processing tests for Massachusetts. There are now nearly 100 labs doing this, and they're all here in Massachusetts. Our average turnaround time for testing is less than 2 days. We have over 250 testing sites in the Commonwealth and free Stop the Spread testing sites in 18 communities to continue to increase access to testing. Criteria for testing has also been greatly expanded to allow people to get a test without question, even if they have no symptoms. I want to take a minute to underscore this point. The Commonwealth made significant progress to prevent the silent spread of COVID. Early on, the medical community was working furiously to understand the nature of this virus, including how it spread asymptomatically. It's likely this characteristic of the virus led to wildfire transmission rates. We now have several tools to tackle the silent spread of COVID. It starts with all the work people have done around infection control, face masks, distancing, hygiene, and then testing, which includes contact tracing and standard practices throughout the Commonwealth workplaces and public spaces. And no one, for the most part, shakes hands, hugs, gives high fives, or engages in close talking with anyone anymore. Previously, it was also only advisable to test for COVID if you met a specific set of criteria, including symptoms. But now that the silent spread is better understood by the medical community, our testing and tracing is equipped to meet this challenge. Colleges, universities, and long-term care facilities are constantly testing people. The ability to repeatedly test students, staff, caretakers, and our elderly in these types of settings has caught cases early and prevented contagion. Today, colleges are conducting over 25,000 tests a day, and long-term care residents and staff are being tested by the thousands. This rapid testing, contact tracing, and isolation has ensured that no college or university has had more than 200 cases, a remarkable statistic considering the size of the populations at some of the schools that have suffered small outbreaks. And last week, the positivity rate for testing at colleges and universities was 0.1%. Addressing the silent spread obviously requires a lot of resources, but the Commonwealth has put a concerted effort into keeping cases down, and that process will continue. Like other states and countries, Massachusetts saw how COVID tragically impacted our older population, particularly our seniors being cared for in nursing homes. Our state has hundreds of long-term care facilities, and many were impacted early. We took immediate action to try to keep COVID out of these facilities by requiring a range of infection control measures, even prohibiting family visits for months at a time. I know this was incredibly painful for many people because it happened to me. I didn't see my dad for over 100 days. In April, the Command Center launched the first in the nation mobile testing program with the National Guard to provide testing to nursing home staff and residents, and provided more than 57,000 tests at almost 500 facilities throughout that period. In the spring, we created an unprecedented accountability and supports package for nursing homes that provided significant funding dependent on the performance and clinical infection control audits. Clinical staff performed over 1,000 audits at these facilities during May and June. Throughout the spring and summer, the Commonwealth committed over $260 million in additional funding to support nursing home residents and staff, which is in addition to at least $180 million in federal funding. Our administration has provided 2.8 million pieces of PPE to nursing homes since March, which is more than we have provided to any other particular healthcare group. In September, we also announced a second round of reforms for long-term care facilities to make sure their residents and staff have the supports to stay safe, including new requirements associated with the flu vaccine. Secretary Sudders will talk more in detail about this in a minute. Now, last spring, closing schools and shifting to remote learning for all schools was an enormously difficult decision. But it was necessary at the time to protect students and faculty from the virus when cases were dramatically rising and guidelines for making schools safe did not exist. It's a lot to ask of parents to work from home while helping young children navigate a whole new way of learning. The creativity and resourcefulness of teachers and parents kept learning alive for kids, but we do know that for a lot of students, the spring's learning environment was less than ideal. Secretary Pizer and Commissioner Riley worked with public health experts and Massachusetts pediatricians to develop plans to get kids safely back to school. And in June, the Department of Elementary and Secondary Education published hundreds of pages of guidance for our schools to get kids back for in-person learning where the public health data permitted it. And as I said previously, this guidance has been endorsed by the Massachusetts chapter of the American Academy of Pediatrics. And based on today's data, in a majority of communities, where there's little or no COVID, it's safe to return for some in-person learning. We've also allocated over $1 billion in funding to local communities to support schools for everything from PPE to school supplies for various learning modules. And many schools are reporting great success with in-person and hybrid models. We were joined here a few weeks ago by the Quincy superintendent and assistant superintendent to hear about their success over the summer with in-person learning for special education students. Having kids back in the classroom is what's best for their education, development, and safety, and we'll continue to work with schools and communities to support safe learning models, including pods and after-school programs. As I mentioned briefly before, we learned a lot about COVID since last spring. And early on, we put in place a wide range of orders and guidance to keep people safe. In May, we started requiring folks to wear face coverings if they couldn't socially distance. And we've launched several public messaging campaigns to remind people to socially distance, practice good hygiene, and stay home if they're sick. We issued strict travel guidance for people to quarantine for 14 days or get a test upon arrival. Hundreds of thousands of travelers have filled out the mass travel form before they came here. Working with the Reopening Advisory Board, we issued guidance for every sector of the economy to open business and resume activities while fighting the virus. And we executed a gradual strategic approach to reopening nearly all sectors of our economy starting in late May. Now, almost 6 months later, our economy continues to run. Hundreds of thousands of people have gone back to work with a constant respect for the threat of the virus. From gathering limits to industry-specific guidance, we now have proven protocols in place that make it possible for people to be working. It's a far cry from the early days when every nation and every state had more or less two choices, open or close. These rules only work because of individuals' choices and how residents have changed their daily routines to adjust to the pandemic. Today, it's routine to grab your mask on the way out the door or to use hand sanitizer immediately after being in a public space like a grocery store. That said, there's no question this has been tough on everyone. Not seeing family members, grandparents in person, or canceling or dramatically altering special ceremonies like weddings or graduation parties is rough stuff. Many people have lost loved ones to this virus and maybe never had a chance to say goodbye. But we have today exponentially more knowledge and more tools available to fight COVID-19 than we did early on. And that knowledge makes it possible for us to identify cases and close contacts, help people quarantine and isolate, and work with our healthcare providers to make sure that they have the resources and the gear that they need to take care of the people who do get sick. It gives us the data and the infrastructure that we need to work with our senior and long-term care providers to make sure our nursing homes are safe and that their staffs and residents are safe as well. It gives us daily updates on our colleges and universities, as well as constant updates on our schools and child care providers. It also gives our employer community the information and the tools that they need to keep their employers and their employees and their customers safe. There's no question that there will be more cases this fall. That prediction was made last spring by researchers and public health experts. We needed to be prepared to identify those cases early, keep our health system strong, and protect the most vulnerable among us from the uptick. We've done the work. We're prepared to respond to this virus like never before. But our preparations are of little use without the people of Massachusetts continuing to do their part. What we need from you is continued vigilance as we head into the 9th month of fighting this virus. Face coverings, distance, and hygiene are all part of the plan, and in formal work and public settings, you have been delivering every single day. But we also need your vigilance and your focus in smaller, less formal settings, especially as we all move from our backyards to our living rooms and our family rooms. Household spread, intergenerational spread. Expect to hear these terms a lot this fall. We all have a role to play here, and it doesn't end when we come home for work or the supermarket. If you've been out of state or around a bunch of people without masks or distancing, you need to socially distance and wear a mask around your family, and you should get tested. That's why we have so many sites. Use them. Stay vigilant and respect the virus. I know that we'll continue to make it through this together because the people of this Commonwealth are resilient and disciplined. And we've all done a lot of work to prepare for the fall.